Hello everyone, my name is Dr. John Adam here with Pawsitive Health, where we believe that client education improves pet health. In this video, I'm going to go over some mistakes people make with taking care of their pets. In my years as a veterinarian, I've noticed some repeated mistakes that pet owners make that can put their pet's health at risk, and I will be going over 10 of them in this video. Hope that after going over these mistakes that we can together be more aware of them and prevent them from happening so that we can take care of our pets better. The first mistake I'll go over is not getting pet insurance. Unfortunately, our pets' medical bills can get very expensive. In the past couple years, the cost of medical care for our pets has increased dramatically, and there is no signs of it slowing down. Because of the immense cost of medical services, one of the top reasons why pets are euthanized is because pet owners can simply not afford the medical treatment needed for their pet. This is why insurance is so important to help cover the costs when our pets need significant medical attention. Unfortunately, if a problem does arise with your pet before you get pet insurance and then you get pet insurance afterwards, they will not cover it since it's a pre-existing problem. If you do not want to go the insurance route, you should at least make a savings account for your pet that you put money in frequently so that when your pet does need medical attention, you are able to cover the costs. Mistake number 2 is not taking your pet into the veterinarian for routine visits. Even though your pet may be healthy, routine visits can help catch problems with your pet before they become an issue. This includes routine diagnosis such as lab work and fecal analysis. These routine exams should be done at least yearly, but should be more frequent when your pet is young, and also for senior animals as well, because they are more prone to certain issues at these ages. Mistake number 3 is related to number 2, and that is not coming in for your recheck exams. Even if your pet seems 100% better, you should still continue to come in to the recheck visits your veterinarian requested. One reason being is that we are trained to see things you may not see. So you may think your pet is 100% better, but we may see it differently. And if you don't come in back in for your recheck so that we can follow it up with the problem, then the issue may come back or get worse. Also, if your pet is not doing as well as expected, the follow-up visit will give us a chance to adjust the treatment plan so that we can make your pet better. Another reason is that a lot of our problems we deal with are long-term issues. We usually will address the problem and get your pet stable, and then in future rechecks we'll discuss with the owner a plan to make sure that we can manage the underlying problem or try to prevent it from being an issue again, or at the very least limit the effects it has on our pet. For example, with allergies, we usually see them when they have an infection and are very itchy, and so we address that in the first visit. And then on follow-up visits, we will develop a treatment plan to help manage the allergies since they never truly go away. Mistake number 4 is not getting routine dental cleanings under anesthesia. These should be done at least yearly and sometimes more often depending on your pet. Cleanings along with brushing their teeth daily will help reduce dental disease and its effects such as pain, decreased appetite, and infections. I will link a video here that I made that goes over in more depth on why dental hygiene is so important for our pets. Mistake number 5 is not giving medications correctly that are prescribed by your veterinarian. This includes not giving the entire amount prescribed because they are supposedly better and don't need the medication according to the pet owner, not the vet. Not giving the medications at their frequency indicated, and increasing or decreasing the dose prescribed. There is a reason your veterinarian prescribed the amount, the frequency, and the duration of whatever medication they gave. We will not give you too little or extra medication on purpose, so please follow the instructions as they are given. Also, changing the treatment without a veterinarian's input can put your pet in harm's way, or at the very least, not take care of the issue you came to them for in the first place. If you do have an issue with the medication prescribed, then please call your veterinarian and explain your concerns so that we can properly address them, and don't try to do it on your own. Mistake number 6 is related to number 5, and that is giving medications that are not prescribed to your pet. This includes over-the-counter medications and medications prescribed to other furry members of the household, including things like flea preventatives and over-the-counter pain medications. This can be very dangerous for reasons such as the over-the-counter medication may be toxic to your pet, medications given to another pet might be the wrong dosage for this pet. The medication may be harmful to this pet, specifically with their current health status, and what you are giving may not help but may cause further issues. Or what you think you are treating may not be actually what's going on, especially without a proper diagnosis by your veterinarian. So please consult your veterinarian before giving any medications, even if it seems to work for your other pet, or even if it did work in the past. Mistake number 7 is not putting your pet on a flea preventative. I've had so many clients swear they never see a flea on their pet, only to find fleas on their pet. There are some places that may not need prevention year-round, but here in California, it is recommended 12 months out of the year. If you don't see fleas, that is a good thing. We want to keep it that way. Do you get car insurance after you've had an accident? No. The reason why we are on flea control is so we don't ever see fleas, and just because you don't see them doesn't mean they are not in the environment, because they are. And if you do see one, then there are usually hundreds more in the environment. Also, with indoor cats and dogs, we still recommend prevention because you can still bring in the fleas into your home. And I don't know of a flea that obeys the laws of a private sanctuary and won't come in when there is an open door or window. Mistake number 8 is not putting your pet on heartworm control. This parasite is even worse than fleas and can be fatal to your pet, so why risk it when we have a simple and easy way to prevent it from happening? Heartworm disease is becoming more of a problem in more areas throughout the United States, so don't forget to put your pet on either an oral or injectable heartworm control. I will link a video here that goes in more detail on why heartworm prevention is so crucial for your pet. Mistake number 9 is not consulting with your veterinarian on food recommendations. Veterinarians are trained on what your pet's nutritional needs are, especially when they have concurrent diseases like kidney disease or pancreatitis, to name a couple. Also, we know how to interpret the analysis of a pet food to make sure it is giving your pet the proper nutrition they need. We may not know about all the different brands out there, but a good veterinarian will be able to research that food that you may have questions about and will give you an accurate assessment on whether it is good for your pet. Spoiler alert, most table scraps are bad. And finally, mistake number 10 is not bring your pet in sooner when they have a problem. No, you should not wait until your dog hasn't eaten and has been vomiting for a week. I always tell clients it is better to safe than sorry and bring them in when there is a problem than have us tell you it wasn't too big of a deal in the first place. I'd rather have that than the opposite and we left your pet suffering for more time than it should. I mean, would you want to suffer being sick for a longer time than you should? Also, a lot of times, if brought earlier, the treatment may not be as extensive and as expensive as if you brought them later and now they're really sick and need to be hospitalized or require other more serious treatments. So please bring in your pet when you first see the problem and don't try to just wait it out. So this concludes the 10 common mistakes pet owners make with their furry loved ones. Hopefully with this information, we can take care of our pets better and provide them with better health choices in the future. If you like this video or found it helpful, please give it a thumbs up and subscribe to the channel. If you have any questions, comments, or future topics you would like me to discuss, please leave a comment down below and I'll make sure to get to you as soon as possible. Thank you very much and see you soon. Spicy.